topic we are going to discuss is about the Mpds, that is the myofascial pain dysfunction syndrome. So starting with the definition, what is Mpds? So when a muscle spasm it develops, the dysfunction as well as pain occurs. That is the condition which is called as Mpds, in which there is a muscle spasm develop, there is a dysfunction as well as the pain which occurs. This condition is called as Mpds. So it is initiated as a spasm of one or more masticatory muscle. So the temporomandibular disorders, these are the group of the maladies which can affect the TMJ as well as the associated muscles of the jaws, of the face and of the neck, as well as it is related, these all are related to the neurological and as well as to the vascular structures. Coming on to the etiological factors, what are the causes? First is the tooth muscle theory, in which the occlusal interference it usually causes an alterated proprioceptive feedback which leading to the incoordination and spasm of the muscles of the mastication. Important. The prosthetic problems due to the any faulty prosthesis, overclosure or bilateral loss of the molar teeth and increase the vertical dimensions. The malocclusion by any of the oral habits, like for example clenching or the grinding of the teeth or due to anxiety. Next is the psychophysiologic theory, in which the spasm of the masticatory muscles it causes the Mpds, degenerative arthritis and the contracture arthritis. Steep angulation of the articular eminence is also a cause of Mpds. Coming on to the clinical characteristics, so in this the Laskin's cardinal symptoms of the Mpds are, in which number one is the pain or the discomfort anywhere about the head or the neck, the limitations of the jaw or the motion of the jaw, the joint noises like the grating, clicking or the snapping sound, the TOP of the muscles of mastications. While the negative characteristics are the absence of the clinical, radiographic and biochemical evidence of the organic changes in the TMJ, the lack of the tenderness in the TMJ area when palpated via external auditory meatus. A zone of reference, trigger points in the muscles, occasional associated symptom and the presence of the contributing factors. Next are the symptoms, and these are very important, commonly asked in your competitive exam. First are the neurological causes, in which there is a tingling, numbness, blurred vision, twitches and lacrimation. While in the GIT it causes, the symptoms are nausea, vomiting, diarrhea, constipation and indigestion. While in the musculoskeletal it causes fatigue, tension, tiredness and weakness. And in the otologic it causes tinnitus, ear pain, dizziness, vertigo, diminished hearing. Coming on to the trigger points, important. So the trigger point exists as a localized tender areas within the taut of the bands of the skeletal muscles, and it is stimulated by the macro and the micro traumatic episodes. Important. And they refer a characteristic pain to a distinct group of the muscle, that is the zone of reference. The palpation of the triggered point it gives a positive jump sign. Important. Coming on to the disc displacement. So the disc displacement it is the most common TMJ arthropathy, and it is defined as an abnormal relationship between the articular disc and the condyle. This is what the disc displacement is. So clinically, this popping sound or the clicking is regarded as an initial symptom of the temporomandibular joint internal dearrangement, that is TMJIT, temporomandibular joint internal dearrangement. So if the displaced disc returns to its normal position when the mouth is open accompanied by a popping sound, it is referred to as disc displacement with reduction. Important. If the disc displaced does not return to its normal position and act as an obstacle during the attempted mouth opening, the joint appears as locked. This referred to as disc displacement without a reduction. This is the differentiating features between the two. So this is the temporomandibular joint. This is the normal position. The disc stays in the place when the jaw is used, while this is, see, this is in the normal position, while in the second one this is in the abnormal position. The disc is pulled forward when the jaw is in use and causing the bone structure to grind together. This is the disc. This is the temporomandibular joint. When the jaw is closed in the normal disc position, it is in the proper position. When the jaw is open, it is also in the proper position. While in the disc displacement, with the jaw clicking, the disc is in proper position, and when the disc displacement with the jaw locking, the disc comes forward. While the TMJ dislocation, in this the subluxation or the hypermobility in the temporomandibular joint, it is defined as the clinical condition with the repeated episodes of the partial dislocation of the jaw. It is a self-reducing incomplete dislocation of the jaw, which generally follows the stretching of the ligaments and the capsules which surrounds the TMJ. So this is the X-ray which shows the bilateral dislocation when the patient opens its mouth. This is the mandibular condyle, this is the articular eminence. This is the bilateral dislocation of the mandible. Now coming on to the examination, so you have to take the thorough history, physical examination, radiological examination. Radiography includes the normal radiography and CT or the tomography, arthrography, electromyography, MRI and arthroscopy. Physical examination, the palpation of the masticatory muscles, observation of mandibular motions, palpation of the joint of the TMJ joint. This is the radiographic, see, this is the radiographic evaluation. Coming on to the treatment, so in this, the patient education and the self-care. Conservative treatment, it includes the application of a moist heat, ice application. You have to tell the patient for the soft diet, jaw exercises, relaxation technique and sleep on one side. Surgical treatment includes the arthrocentesis, the arthroscopy, arthrotomy and TMJ implants. This is the arthrocentesis, flushing of the fluid from the joint and gently stretching it. Arthroscopy is use a miniature telescoping instrument to diagnose and repair the joint. Next is the arthrotomy, in which the open joint surgery, it is more complex cases. So in this first needle, it injects out the fluid, and second needle, this is the first needle, this is the second needle, it is attached to the syringe to remove the excess fluid. So this is arthrocentesis. So this is all about the Mpds. Please go through it once and try to make the notes. Thank you.